The title of my module is Patient Factors, Medical Factors, and relates to the preoperative assessment of the patient prior to implant therapy. I regularly deal with implant patients and assess patients before implant therapy, and it's my huge interest actually to have as few complications as possible. And the best way to reduce the amount of complication is a thorough preoperative examination, and that includes also patient factors like medical factors. Medical factors are extremely important because through a systematic preoperative examination, you might experience that there are factors that actually absolutely contraindicate implant therapy, meaning that if you place implants in those patients with these contraindications, you really might run into serious complications. The learning objectives of my module would first be to do a general assessment of the health status of the patient. Thereafter, we go into the systematic approach to obtaining a medical history of the patient and thereby trying to reveal any risk factors for implant therapy. And the last part would be to identify and distinguish between absolute and relative contraindication for implant therapy for the individual patient. After completing the module on medical risk factors, the learner should be able to make a general evaluation of the health status of a potential implant patient. They should be able to identify risk factors for implant therapy, and they should be able to list and acknowledge absolute contraindications and relative contraindications for implant therapy.